The motion on the need to address the rising cases of mental health in Nigeria was brought to the floor of the House of Representatives by Honorable Uchechukwu Nnamobi from Rivers State. Moving the motion, the lawmaker observed that 3 out of 10 Nigerians have one form of mental illness or the other. He said presently there is no mental legislation in Nigeria, noting that Nigerian mental health policy is only the framework that has access to mental health care, dealing with mental and neurological disorder in Nigeria, discouraging stigmatization against persons with mental disorder, and has institutionalized standards for psychiatric practice.
The House notes that the World Health Organization considers mental health as a state of well-being in which individual can cope with the stresses of life, work productively, and contribute to the community. The House also notes that mental illness manifests in mood disorder, anxiety disorder, trauma-related disorder, personality disorder, old age-related disorder, substance abuse disorder, or mental pattern that causes significant distresses or impairment of personal functioning. The House further notes that according to the World Health Organization, statistics of over 20 million Nigerians are currently suffering from the various degrees of mental illness or disorder without psychiatric help or care. The House observes that 3 out of 10 Nigerians, I repeat that, the House observes that 3 out of every 10 Nigerian have one form of mental illness or the other. Presently, there is no mental health legislation in Nigeria because the last we had was sometime in 1961, which was still the Lunacy Ordinance, and another in 1958, which only gave the magistrates, when it was amended, the right to detain those who were mentally challenged. Now, up until 2003, nothing has still been done. Therefore, there is need for that. The House also concerned that the increase in the cases of depression is traceable to malfunctional, multifactorial, and interpersonal issues which lead to suicidal death in the country, and this requires urgent attention. Also concerned that Nigeria has only 130 to about 300 psychiatrists with over 20 million citizens suffering from mental disorders. The House worried that with a few functional medical health facilities and inadequate mental health practitioners in this field especially are left for traditional medical practitioners. Hence the upsurge in the mental health in Nigeria. The House also worried
Please approach the Chief Whip.
The House also worried that the statistics are troubling and the continued lack of legal framework on mental health in this country will simply cause the situation rather to degenerate. Knowing and being fully aware that the last was done in 1958, the law is actually obsolete now.
Track up Honorable Uchechukwu Nnamobi. The House, however, resolved to mandate the Committee on Health Institutions and Healthcare Services to liaise with the Federal Ministry of Health towards improving mental health around the country and to further carry out serious sensitizations of Nigeria. It also mandated the Committee on Health Institutions to explore the modalities of liaising with stakeholders with the health sector to promote, educate, and sensitize Nigerians on mental health and report back within 6 weeks for further legislative action.